So your interview is nearly over and it comes to the question, do you have any questions for us? Now this is your chance to stand out and show professionalism and to make sure that this role is right for you. So today we're going to look at 5 powerful questions that will leave the panel remembering you for all of the right reasons. Hello, you're on Shift with Sian, the platform that empowers student nurses with the knowledge, the tools and the support to build confidence in practice. Welcome back to part 2 of my nursing interview series. In part 1 we looked at how to answer scenario-based interview questions using that STAR framework. Now if you missed that, I will put the link to that in the description. Today we're focusing on your questions, the one that you ask the panel at the end of your interview. Now a lot of candidates skip this opportunity to ask generic questions, but when the competition is high and the nursing posts are limited, this could set you apart. It's your opportunity to show a little bit more of your character and ask the questions that you really want to know. And then you get a little bit of a feel for, is this job right for you and does it align with your values? So let's dive in then. So the first question, or one of the first questions I would ask is, what qualities do your most successful nurses have? Now why this question is good is because it shows that you want to grow and that you want to work in an effective team. For your character, it shows that you've got professionalism, ambition and that you've got willingness to learn. Now a follow-up to that would wait for them to tell you what those successful qualities were and then suggest a time where you've shown that quality, or say that you admire nurses with that quality and that you're keen to explore that quality in yourself. Number 2 on my most powerful questions to ask at interview is, what opportunities are available for further training and career development? Now why this question is good is it because it shows long-term interest in the role and a commitment to professional development. For your character, it shows that you've got motivation, that you're forward thinking and that you're loyal. Now a follow-up question to this when they tell you the answer is to actually tell them what your long-term goal is. Do you want to specialise or do you want to take more of a leadership role? Question number 3 then, I'd ask, what is the biggest challenge that your team or your ward face right now? Now why this is good is because it shows curiosity, a problem solving mindset and a proactive thinker. It also shows you what you're getting into. For your character, it shows engagement, understanding of real world pressures and initiative. Now a follow-up to that when they explain what their biggest problem is that you could tell them that you've experienced something similar if you have, or say, I understand why that could be quite difficult. So show that empathy and get that you understand those real world struggles. Number 4 then is, what support systems are in place for nurses who have or want to develop special interests or skills? For example, I'm interested in, insert something there that you're interested in, for example, wound care. Why it's good is it because it shows curiosity, ambition and a long-term focus on your personal growth. It also shows that you're proactive and you value that continuous learning. As a follow-up to this, tell them what you've done in the past or ask about link nurse or champion nurse roles and what's available. Mention if you've made any posters or attended any events in that area or shared your learning. So as a manager, it's sometimes really hard to fill those link nurse roles and you end up just allocating them, for example, sepsis or wound care, diabetes. So having somebody who's passionate about that area makes you a very valuable part of the team. Number 5 then on the most powerful list of questions to ask at your nursing interview is, tell me about a quality improvement project on the ward at the minute. And that's if you don't already know of any. Do your research. Have they been nominated for a quality improvement award for something? It gives them a little bit of an ego boost by saying that you were impressed by the project and asking if there's any updates. Why it's good then is it because it shows that you've done your research and therefore likely to be committed to the role. It's not just a job until something better comes up. It also shows that you've got a focus on quality improvement, patient-focused care and a passion for improvement and possible involvement in future projects. Ask if there's any opportunities to be involved in current projects and how open they are to suggestions for improvements. Also mention any improvement projects that you've been involved in. So my final tips then on questions to ask at your interview are: ask 2 to 3 questions maximum. Listen carefully to what they say and engage with their answers. It's your chance to show your curiosity, a bit more of your character and your professionalism. So final questions there are really there to give you a chance to leave a memorable impression, show your values and to prove that you're invested in this role. So from part 1 of this nursing interview series, you're able to answer the scenario-based interview questions that are asked of you at your nursing interview. And now after watching this, you know what questions to ask them to leave a memorable impression. But all this could mean nothing if you don't have the right nursing etiquette in your interview. And that's exactly what we'll be covering in the third and final part of this nursing interview series, the do's and don'ts of nursing etiquette in your interview. So join me then on Monday at 9 AM for the final part of this nursing interview series. Subscribe and click the notification button so that you don't miss this. Be kind to yourself, we've got this.